So the first thing I'm going to do is check my patient's medical record for the type of surgery she's had and any orders from my provider. I'm then going to put on any PPE if needed before going into my patient's room. So can you please state your full name and date of birth?
Laura May Parrish, 10/13/99.
Okay, I'm checking her wristband in with the computer. And my name is Maddie Danaski. I'm a student nurse at LSC. I'm going to do hand hygiene. Okay, and I have already came here 30 minutes prior to this to make sure she's not in any pain. I gave her pain meds already. I've done a full focused assessment on her, and this also includes a full set of vitals. So I'm pulling the curtain for privacy. Have you had any recent surgeries?
No.
So you're not familiar with the deep breathing exercises?
No.
Okay. So we do the deep breathing exercises to facilitate respiratory function and to make sure that you don't get any respiratory disorders such as pneumonia, and then it just gets all the secretions out of the lungs. So what I'm going to have you do is I'll show you first, and then I'll have you demonstrate it back to me. So I'm going to have you put your hands here, and you're going to exhale, and you're going to inhale. You're going to hold it for 5 seconds, and then you're going to exhale out of pursed lips like you're whistling. You're going to practice that 3 times, and you can do this 1 to 2 hours, every 1 to 2 hours for 24 hours after surgery, or as much as you need to. So I'll have you demonstrate that for me. 1, 2, 3, 4, 5. Great. So now I am just going to move on to teaching you how to deep breathe and splint your incision. The reason why we splint our incisions is to reduce pain when you do have to cough. And the deep breathing and coughing gets all that mucus and secretions out of your lungs. So you're already in the semi-Fowler position, and you are going to go ahead and lean forward. And you're going to breathe in and out through your nose 3 times. Yep. And then I'm going to have you take 1 big breath through your mouth and cough out 3 short breaths. And then I'm going to have you take 1 more inhale through your mouth and cough out 2 deep coughs. Yeah. And you're going to do that about every 2 hours after surgery. So do you have any questions about that?
No.
Okay. So now I'm going to have you use this spirometer. And I am going to have you support it with this hand, and then you're going to hold the other piece here. I'm going to have you exhale, and then you're going to inhale, and you're going to hold it for 3 seconds, and then you're going to exhale again. If you feel any dizziness or anything during this process, I'm going to have you stop, and I'm going to be checking the gauge as you do it just to see where you're at.
Okay.
And if you need to cough or anything, just make sure that you're splinting that incision with that pillow.
Okay.
Okay. Okay, so you're gonna do that you're gonna do that 5 to 10 times every 1 to 2 hours after surgery. And yeah, this concludes your deep breathing exercises. Do you have any questions for me?
No.
Okay, and you just want to make sure to do those, like I said, as much as you can. So I would wash this off, and then I would shake it to let it dry. I am making sure that my patient is in the lowest position with her call light. Her bed rails are up. I'm documenting my findings, doing hand hygiene, and taking off any PPE if necessary.